right, preparing for a live stream. Awesome. We're live. So welcome everybody that's joining us today. I'm super excited for this conversation with Dr. Nicole DiNezza, who I just told her I feel like I'm talking to a celeb because I absolutely love her podcast called the IBS Freedom Podcast. Dr. DiNezza is a functional medicine doctor who specializes in helping women with IBS. For live stream. Oh, here's I gotta turn the sound off. And SIBO. She has helped hundreds find a holistic cure and most importantly, be able to successfully reintroduce FODMAPs back into their diet. So she's a specialist on FODMAPs, gut health, acid reflux, herbs for acid reflux. And so I'm really, really excited to get her perspective on how to manage acid reflux from a more holistic perspective. So we're going to be talking about today kind of the causes of acid reflux, as well as PPIs, and of course with absolutely no shame towards any type of medication or anything like that, but just objective PPI and herb use, things to keep in mind if you're struggling with acid reflux. So anything else you want to add before we dive in?
No, I don't think so. That was a nice intro. I'm happy to be here.
Awesome.
I think it's just a matter of exploring options and knowing that there's no one way to treat anything. IBS, SIBO, GERD, anything. There's going to be options, and you need to pick what's right for you as an individual instead of just thinking that there's like some magic protocol that you need to stick to. But I think that having those conversations is really important so that you can make the right decision for you instead of just blindly following something. So happy to be here.
Yeah, 100% agree. And I was just mentioning before we went live that I had another doctor who was amazing. She came and talked to us about the causes and treatments of acid reflux that she normally does. And it's just great to get other perspectives because just like nutrition, like I come from a dietetics background, we always say nutrition is so individual. There's no one size fits all. There's no hard and fast rules of what the best diet is. And it's great to just get other perspectives and know that you have options. As somebody who struggles with acid reflux, it can be so isolating and confusing. So it's great to get another perspective and know that there's different ways to go about it.
Yeah, absolutely. Well, where do we begin?
I think we should begin with some of the biggest like causes that you see in your practice, some things that maybe people are doing wrong that are not doing wrong, but some things that people may be doing that can be contributing to acid reflux, or some things that people may not be doing that can contribute to acid reflux.
Okay. Yeah. So like root causes,
yes.
If it were. Yeah. So I think that you touched on something already, which is like things that people are doing that might be problematic for this. And it's not from this energy of like, itty poo on you, you're a bad person for doing this and like blame. It's just, if you're aware that a certain behavior or a certain thing is not well suited to your physiology in that moment, then you can make a new choice. But one great example is eating way too much, way too late at night, right? So if I just had a conversation with a patient not that long ago, maybe this week, and she mentioned that she usually eats dinner at like 9 o'clock at night because she goes to work and she gets home and then she goes to the gym. And by the time she sits down for dinner, she eats dinner at 9 p.m. And then she'll go to bed maybe half an hour later. And it's like, ooh, yikes, that's a lot for your poor body to process. And then same conversation, like sometimes I'll see that pattern too with people who don't give themselves a lunch break. So they're just literally go between breakfast and then have a late dinner, shove that food in their body as fast as they can, and then expect their body to go into rest and digest and sleep it off. Right. But you have to give your poor stomach enough time to actually empty. Otherwise, you're either going to get acid reflux or just this feeling of like indigestion and feeling like the food just kind of sticks around way too long, or this overall like blah feeling. And that's not doing you any good, any favors. So I think that eating too much food late at night or just eating too late is one of the big things. If you can try to space out your last meal of the day at least 2, 3, 4 hours before bedtime, that would be ideal. So if you could do if you have a 10 p.m. bedtime, try to eat around 6. I think that would be the best way to go about it. So that's one thing. Another thing that doesn't get talked about a whole lot actually is gum and mints. I think the peppermint in and of itself regardless of the sugar and everything else that's in it. But the peppermint in a lot of breath mints and gums loosen the tone or lower the tone of the lower esophageal sphincter. And then that can let more acid reflux up into the esophagus and cause more of that burning sensation. You might not have too much stomach acid. It just might be that your lower esophageal sphincter is all loosey-goosey and it's letting more acid come up into the esophagus. And then ironically, of course, a lot of people take encapsulated peppermint oil capsules for IBS.
Right.
That if they also have reflux, the thing that is helping their IBS and is a reasonable, well-researched Band-Aid for IBS might actually be making the reflux a bit worse. So you kind of have to pick and choose your therapeutics and like what is best matched for you as an individual.
Yeah.
So those are two that are just like more in the lifestyle kind of realm of possibilities. I think inactivity to some degree can cause acid reflux and indigestion as well. As far as like medical diagnoses that would cause reflux, probably the biggest one to rule out is H. pylori. So that's a bacteria that can live in the stomach. It is in the stomach for most people. I think like 70% of the world, if I remember correctly, is colonized with H. pylori in the stomach. So the presence of H. pylori isn't necessarily a bad thing, but if it's overgrown, then it can be problematic and it can be really invasive into those cells of the stomach, and it can lower your stomach acid, and it can cause more reflux and gastritis and ulcer type symptoms. And then that can be really problematic. You would ideally want to get tested either if you are getting an endoscopy, then your doctor could quickly just do a check for H. pylori when they're in there for the endoscopy, or you could do an H. pylori breath test, which is super simple and easy to do, way easier than a SIBO breath test, because it's just you drink one sugar solution, you wait 15 minutes, you breathe into a tube, and then you're done. But you can do a breath test, or there's a stool antigen test for H. pylori that's reasonably decent as well. I probably wouldn't bother with a blood test, but those are usually the ways that I would assess for that. But H. pylori overgrowth or dysbiosis is not uncommon. So I think ruling that out is pretty reasonable for a lot of people to start with. And then beyond that, there's the whole conversation of like, do I have low stomach acid or high stomach acid or both? And like, this is one area where the conventional medical world and the hippy dippy crunchy world do not agree at all.
Yeah.
In one camp, if you go talk to a naturopath or a functional doctor, almost everybody aside from myself is going to say that all of our patients have low stomach acid. And if you go talk to a normal conventional GI, they're going to tell you all of my patients have high stomach acid.
Yeah.
It's like, well, the truth must be somewhere in the middle, guys. Can we just talk about it? So I think that high stomach acid is probably less of a likelihood. But what I do see a lot, at least that I theorize, is that I think a lot of people have more stomach acid than they are able to cope with in that moment. And that's largely because their stomach is inflamed. So that if you have, it's kind of like, think of inflammation like a sunburn. If you had a sunburn and then you squeeze some lemon juice onto that sunburn, oh my God, you would think that that lemon juice was the most evil substance on planet Earth, right?
Yeah.
It's not that lemon juice is bad, and it's not even that you shouldn't be able to put lemon juice on your skin. It's just if you have a sunburn and that tissue is massively inflamed, then yeah, any little bit of acid is going to really piss it off and make you quite miserable. So the inflammation of the stomach lining itself can play a role, and then we incorrectly label that as high stomach acid. Or similarly, if you don't have a nice, thick, robust mucus lining to protect you from your acid, then any little bit of stomach acid becomes problematic potentially, because you don't have the ability to protect yourself from that totally normal physiological substance. Normally, it should be a vat of battery acid, a nice thick wall of mucus, a nice, healthy, non-inflamed, not pissed off wall of stomach cells, and then the rest of your body. And if one of those two barriers is compromised, then any little bit of stomach acid you might have can really tick off symptoms. So that's where I think kind of the middle ground is. I think that truly high stomach acid is probably not so much of a thing. Low stomach acid, I do think, is out there. I don't know if it's everybody, like the hippy dippy kind of world thinks it is, but I do see low stomach acid moderately frequently amongst my patients.
How can you tell the difference between high and low stomach acid?
Ultimately, there's some clinically guided trial and error, honestly, because there is a test available. There is a capsule that people can swallow. It's called the Heidelberg test.
Mm-hmm.
and they can swallow the capsule that it measures the pH of the stomach. I have yet to find a GI doctor who does that test. And even if they could, I don't know if it would be very cost effective or well covered by insurance. So theoretically, there's a test and it wouldn't be terribly invasive. You just swallow a pill, but I don't think it's widely available or widely utilized.
Mm-hmm.
So rather, it usually becomes this game of kind of playing with different therapeutics and seeing what seems to help. Like if you have symptoms of indigestion or reflux, but then you have a little bit of apple cider vinegar or betaine HCl or bitters, and it helps your symptoms, I would be much more inclined to think that you did have low stomach acid, and now we're onto something, and we need to follow that train of thought. If you had, like reflux type symptoms, but you find that the slippery, slimy, mucilaginous type herbs like slippery elm and marshmallow and aloe and licorice are really, really helpful, then I might start to think that you just can't tolerate your stomach acid right now because those things are helping to buffer and give you some distance between you and your acid, right? It's helping to build up that slime and build up that mucus layer and that tissue and de-inflame the tissue of the stomach. So I would think more along that direction if those particular therapeutics have been useful for you.
Mm-hmm. And we'll definitely talk about those therapeutics later on because I have some questions that I want to ask about them because they have been so hugely beneficial in my own healing. But as far as the conventional medicine, why do you think that conventional doctors are so resistant to the idea of low stomach acid?
Maybe for one, they don't have a drug to fix it, right? Like that's probably the easiest answer.
Mm-hmm.
I mean, you remember 10 years or more ago, I remember when I was first kind of studying functional medicine, going to seminars, I remember Karazian joked at one point, and we were talking about leaky gut in the seminar. And he made the point of saying, yeah, right now, conventional medicine is not real savvy with the leaky gut thing, and they kind of deny its existence altogether. Give them 10 or 20 years, and when we have a drug that can heal leaky gut, it's going to be on every Good Morning America, every commercial, every women's health magazine. It's going to be all over the place. Mm-hmm. But we have to get there. Until there's a drug that can fix the problem, conventional medicine isn't too keen to acknowledge a problem, typically. So I think that the same thing here is well, what do they have to offer to us? Mm-hmm. If low stomach acid is a thing, which I do think is a thing, what can we do about it from a pharmaceutical standpoint? And what company is going to give a shit enough to actually fund the research to research low stomach acid? I mean, some of these big functional medicine type companies like Pure Encapsulations, I'm sure they have money to fund something if they really wanted to research betaine HCl. But it's going to be a drop in the hat compared to Pfizer or, a big company like a pharmaceutical company. So I think that that's part of it. They just don't have a tool for us. So they're not going to pay a lot of attention to that particular problem until they have a tool for it.
Mm-hmm. So, and like I mentioned at the beginning of this conversation, by no means is this saying PPIs are bad or that in any way are they not useful, because they totally are. And I myself took a PPI for over a year. It was useful for me for a period of time, but I just really wanted to open up the conversation about PPIs with you because I heard on the podcast your discussion of them. And I really felt like all of my beliefs about the way that PPIs, which are, if you're listening and you're not sure, are proton pump inhibitors. It's one type of medication that's often used to lower the acid in your stomach when you have acid reflux. The way that they are prescribed in the gastrointestinal field, it's a little bit discouraging to me because I feel like they are overprescribed. And so just hearing your point of view on it. So I would love kind of if you could give the listeners a background on what the deal is with PPIs. Why are they prescribed so often, and when are they useful, when are they not, kind of thing?
Yeah, well, and I think they do have some utility. I think they have some usefulness.
Totally.
I'm not in the position of saying I think that they should be taken off market. There's maybe other medications I could get on board with that to some degree, but PPIs I do think have a role. It's just they're prescribed so gosh darn willy-nilly
Yeah.
Like it's like that meme with Oprah where it's like, and you get a car, you get a car, you get a car. It's like, you get a PPI, you get Nexium, you get Prilosec.
Yeah.
And it drives me crazy because I've even had patients who do not have symptoms of acid reflux at all. I've had patients who have just irritable bowel syndrome. They're bloated and they have pooping problems and they get put on a PPI. I'm like, why? Why in the history of the universe would we put this person on a PPI that, by the way, in those cases that I can recollect, like they actually made the IBS worse for those people. Like you had no hint at an acid problem to begin with. So why would you take that drug? That makes no sense whatsoever why it's prescribed.
Yeah.
But to kind of give like the total opposite end of the spectrum, a few years back, I think about 5 years ago, my mom had an ulcer that in the ER they call a geyser. So it was an ulcer that was strategically just over a very large artery, and it made her bleed profusely, and her hemoglobin dropped to about a 6 in a matter of a couple of hours. And for those of you who don't know, a normal range for hemoglobin for a woman is somewhere like 12, 13, 14, maybe 15, somewhere in that range. So her red blood cells basically got cut in half in a matter of a couple of hours because she was bleeding out from this giant ulcer. And I was glad that she was able to go to the ER. She got a blood transfusion. They gave her a big old whopping dose of PPI, and we were glad for it. Because in that moment, you don't want to muck with that and have her bleed out and bleed to death and die. So there's situations like that where it was an emergency, and getting her on a PPI was 100% appropriate, and it was part of what saved her life. But my problem then arose after the fact when the doctor said, yeah, we don't want you to get another ulcer ever again, so you're going to stay on that forever. It's like, I don't know if that's smart. So that's where, luckily she has me. I intervened and I brought her all sorts of hippy dippy herbs and whatnot. And I helped her build back up her stomach to a point where she was able to gradually wean off the PPI. So it was like, we were glad to have it as a rescue remedy for, I think she was on it for probably 6 months, plus or minus a little bit. We were glad to have it on board in that moment, but we knew that we didn't want it to be a long-term strategy because it can compromise your ability to digest your food, particularly protein and iron and B vitamins and some minerals like magnesium and calcium. So the likelihood of her becoming nutrient deficient was one concern. And my mom had a gastric bypass years ago, so she's already high risk for nutrient deficiencies to begin with because of her prior surgeries. So like history of gastric bypass plus PPI, especially for her, we were like, no, we can't risk this. You're already a person who has high risk for that, so that's not a cool thing. But the other thing is that PPIs have been pretty well associated with causing SIBO. That stomach acid is one of the first dominoes in a series of dominoes that needs to happen in order for you to digest your food and to get your motility up and running and to control your microbes. And if you are missing that first domino in the series, it's like, you know how kids play with dominoes and they line them all up in a row and then you knock one over and they all fall down? If you never knock over that first domino, none of the other ones move. So if your stomach acid is out of whack, it could potentially mess with your ability to digest carbohydrates because maybe your pancreas isn't going to squirt out the juices that it needs to squirt out. It could mess with your ability to digest fat indirectly because maybe your gallbladder doesn't get the memo that it needs to squirt out all of the lovely bile that it's stored away for you. It could impact your leaky gut or lack thereof, your microbes, brush border enzymes. It could really just set a lot of things into motion downstream that then can lead to SIBO in some particularly vulnerable people or nutrient deficiencies. So I think those are the two main reasons why I prefer to get people off of PPIs as soon as humanly possible. But if there's an extenuating circumstance or an emergency where you need to mitigate that, or like some of my gastritis patients who are so inflamed and so compromised when they first start working with me, and they're so resistant to the thought of taking a drug, very often I'm the one telling them, look, like I totally get it. I am not one for willy-nilly prescribing of drugs either. I get your hesitancy. I know that there's risk with PPIs, but for you as an individual, I think that even a couple months worth of relief would go a really long way. And then we can get the ball rolling and we can start reintroducing some foods, getting some supplements and some herbs on board, and we can start healing the root causes if we have this Band-Aid in place. But sometimes, especially with gastritis, the inflammation is so severe and so uncomfortable and miserable that it's like you have to find an opportunity to make some forward progress, even if it's just an inch.
Yeah.
And if that means that it's a PPI and that gives you the ability to tolerate other stuff, that it could be a really helpful thing for you to take that PPI for a period of time. I'm not against it. It's just we have to be careful with it and not overuse them and abuse them. That's all.
Absolutely. Yes. And it's awesome hearing your perspective back to back with Dr. Advani. She was amazing. We just had an interview with her a few days ago. And she completely agreed that the PPIs are not to be on forever. But she had a different perspective of the research hasn't correlated with the nutrient deficiencies, which I thought was interesting because if you think about the science, it makes sense that it would impact your digestion. And there are reasons why you may not want to be on them forever, but there's also a huge population that it would benefit for being on them for a period of time. So I'm glad that we're shedding light on that. And so if someone has acid reflux and they do not want to take a PPI, what would be like your first lifestyle steps of helping them? Or other methods?
Well, first and foremost, again, make sure that you're not eating too late and try to the best of your ability to make sure that breakfast and lunch are your bigger meals of the day and that dinner is a bit on the smaller side. If you can do that, I know that that's kind of a big ask because most people in America, at least, like to eat a really big dinner and then we kind of fart around with the other two meals. But if you can, having a little bit of a smaller dinner and making sure that you give yourself at least a couple of hours between the last meal of the day and bedtime and no snacking in between. I think that's number one. Number two is try to get some movement, particularly after the evening meal, because most of the time reflux will get particularly bad in the evening, especially if people go down and try to go to bed, right? So if we can do things therapeutically in the evening hours, that's especially helpful. Like even just if you can take like a 10 or 15 minute walk prior to your evening meal, and then maybe another 10 or 15 minute walk after your evening meal, you're going to stimulate the release of digestive juices, things like bile and enzymes, and you're going to get some movement. And that could be really therapeutic in and of itself, and it's free. You can go out, you could walk around the block one time, go take your dog for a walk or whatever, but just getting some movement, ideally a little bit before and after your evening meal is really, really helpful. Making sure that your evening meal is not too close to bedtime and that it's not too large. And then, like I said, being mindful of the peppermint and things that can loosen the tone of the lower esophageal sphincter. Along the same vein, the nerves that control that lower esophageal sphincter are vagal nerve fibers. So if you can do things for the vagus nerve, that will usually help increase or improve the tone of that sphincter. And then again, you don't get as much of the acid refluxing up into the esophagus, and then that could be really helpful too. So if you like do a quick Google search, like, vagus nerve stimulation, you can get somewhere. We have a whole episode on the IBS Freedom podcast all about the vagus nerve where we talk about it in a great deal of depth. But really anything that could be construed as a stress management or a mindfulness exercise usually will have research that it's good for the vagus nerve. So things like yoga, mindfulness and meditation, Tai Chi, massage, heck, even maybe chiropractic adjustments. Like I could see that maybe playing out. But any sort of like breath work, any sort of stress relief technique, for me, painting. Like this is what I do in my spare time. I'll do like 5 minutes here and there between appointments, slap on a coat of paint or glitter, and I'm gradually beautifying my office, painting all of the thought maps.
They're beautiful.
Thanks. Yeah, they're now you can see the others that are behind me. I don't know what I'm eclipsing here.
They're so fun.
But like whatever you need to do to manage your stress and your mental health, go for it, man. Because I think it's going to help that sphincter. It's going to help that vagus nerve function. And then ultimately it's going to help regulate things like your mucosal lining and your your mucus layer and your stomach acid and your enzymes and all of that stuff that we like to get kind of lost in the weeds about when we talk about testing in functional medicine. But honestly, like even just stress reduction techniques can go a really long way. So those would probably be the first. Supplement wise, assuming that we ruled out H. pylori and that is not an issue, then I'm usually going to go to some of the herbs that we talked about before, like the slimy, mucilaginous herbs that will help coat or de-inflame the stomach. So like slippery elm, marshmallow root, licorice, aloe. In particular, I usually will go for licorice and marshmallow first. I try not to use slippery elm if I can get away with it, just because it's not as sustainable of an herb. So just out of respect for the plant, I try not to use a ton of slippery elm. It does work. It's a wonderful herb. But I find that marshmallow and licorice do a reasonably good job on their own. So I don't very frequently need to use slippery elm, which makes me kind of happy as an aspiring herbalist. But you can get licorice either as DGL, which is deglycerized licorice. They take out the glycyrrhiza that can give some people hypertension. I have low blood pressure, and a lot of my patients have normal blood pressure. If high blood pressure is not a thing you struggle with, I would just get regular old licorice, and you can get it as powdered licorice root, or you could get it as cut and sifted bits, like little fragments of the root. And then you can add that to water, or you can add it to baked goods. It's very, very sweet. So you can add it to water or make a tea out of it or cook it and like really make it concentrated, but you could drink that down a couple times a day. And licorice is particularly anti-inflammatory. So it's not only coating and soothing the stomach lining and the esophagus, but it's actually more so working on the inflammation than I think the other three tend to do. And then marshmallow, usually I'll have people get that as the cut and sifted marshmallow root. You can get it by the ounce or by the pound for pretty cheap, even on Amazon. Sorry, I think there's like a very odd, noisy car leaving the parking lot.
No, we can't hear it, but I think
okay.
that AirPods, I don't know if you can't take them out, that's totally fine, but I think they're a little fuzzy. But so I'm not sure if it's that. I'm not sure, but if you want to keep them totally fine.
I could go get my microphone and we could see if that works, because I have a lapel mic.
Oh, that's all right. I think next time we'll do the mic, but I can hear you. It's just like a little fuzzy. But
yeah,
I think what's up?
I said sorry about that.
No, that's okay. Next time we can do the mic for sure. I'm loving this conversation. So I'm glad
you couldn't hear the noise out there, because there's every now and then there's a ruckus out there. But anyway, so marshmallow, to go back to my herb nerd discussion. Usually I'll have people get that as the cut and sifted root, and you can get it by the ounce or by the pound. They even sell it on Amazon. I think like Frontier Co-op or maybe Starwest Botanicals sells it. And what you do is you can put some of that cut sifted root into a jar or a plastic vessel or something and add room temperature or cold water. And then you're going to let it sit for like a day, maybe two. Every now and then kind of swish it around and give it a little stir, stick it back in the fridge and just let it soak. And what you'll find is after a day or two of letting it soak, the water that it's in will get kind of slimy and kind of viscous. And that's exactly what you want. If you take marshmallow root as a capsule, like a ground up powder in a capsule, I think it has limited effectiveness because you're not giving it a chance to really shine. You're not letting those nice polysaccharides unravel. And that's what really soothes and coats the stomach. It's not necessarily like the bulk, like the dry weight of the herb is not necessarily what we want. We want that slimy stuff to come out of the herb, and then the slimy stuff actually coats and soothes. So what you can do is you can soak it, again, just in the fridge. I usually do about an ounce of marshmallow root per like maybe a quart or so of water, and then let it soak for a day or two, and then you can strain off the chunks of the herb, and you should have a nice slimy viscous liquid, and then you can drink that cup or two, couple times, a cup 3 times a day will go to great effect for most people. And then after that point, if those two herbs don't work by themselves, then that's the point where maybe I'll throw in slippery elm, and I'll just have people get it as a powder. And again, you can get it from like a bulk herb supplier and just put the powder in water, and it's kind of almost like mixing together Metamucil. Like it's going to get real thick and kind of like a very thick snot. And it's not the most lovely herb in that regard. It doesn't have much of a taste to it, but you can mix it with enough water that it's going to be a little bit slimy and boogery, not too thick, hopefully, and you just glug that down. But you could do 5 or 10 grams of the stuff per day to great effect, and it will really go a long way. But I find that sometimes people will underdose on some of these herbs, and they have a lot of therapeutic potential if you use them at a hefty enough dose that they get a chance to do anything. But slippery elm, you can go, 5, 10 grams a day. Marshmallow, you could do a cup of that slimy liquid 2-3 times a day. Licorice, depending on what form you get, you could do, again, like I usually have people mix the powder, either DGL or licorice powder itself. I'll usually have them mix like half a teaspoon in some water and drink that down twice a day, something like that. But those are my favorite things.
So interesting, because if anyone's listening that hasn't seen my previous videos, I released a video last summer about how I cured my acid reflux, not as like a prescription to anyone else, but just kind of my story with it. And I was tired of taking the PPI. And so with not the advice of my doctor, but with the approval of my doctor, he helped me, or we slowly weaned off my medication. And I was able to do that by taking these herbs that I had just kind of looked into the research and found a little bit of research on these herbs. And so I started with licorice root and slippery elm, and I was taking them as capsules. And I was under the impression, and of course I took them separate from my omeprazole because they can bind to medications, or that's what I had read, was that you have to take it separately from your medication. Is that something that you also recommend?
I'm trying to think if I've had somebody take them while they're still on a PPI. I think that's wise. I don't know if I was aware of that they could actually bind to it, but I think it's good to space them out and take that on a relatively empty stomach anyhow.
Exactly. So I was always under the impression that they had to be taken on an empty stomach to get like the maximum benefit. Is that also correct?
I think so. Yeah. For any of those herbs, I would usually recommend on an empty stomach or right before a meal, maybe, and then you could give yourself a few minutes at least to let it start taking effect before you eat. Yeah.
So I for some reason thought you had to wait like at least an hour. So I'm glad to hear that you may still get benefit if you
I think so.
Yeah. And do you recommend the powders over the capsules?
For those, licorice, I could get behind a capsule in one regard because I wish I loved licorice more, the taste, but it is so sweet.
Yeah.
That it's hard for me to consume it. I know it's good for me and I need to take more of it, like for me personally, but I cannot get behind how sweet it is. And it's not like, I'm not like an anti-sugar nutso person. Like I love chocolate and ice cream, don't get me wrong. But for some reason, that level of sweetness, my brain goes, whoop. So like licorice, for example, I could see that being perfectly therapeutic. And you can even take it as a tincture too. I do a lot of work with herbal tinctures, which are alcohol extract herbs. And I use licorice as an alcohol tincture sometimes too. But yeah, you could do that one as a powder, or the capsule rather. Slippery elm, I probably would wager that slippery elm is going to be significantly better if you do it as a powder and then mix it with the water or mix it with some sort of liquid and then drink it down. Because again, you're kind of starting to hydrate some of those polysaccharides and some of the stuff in the herb that actually soothes and coats, instead of just dropping the dry powder into a vat of acid, essentially. I could see where adding it to the water would actually be beneficial. And then the marshmallow, I think marshmallow is way more effective if you do it as a drink. Because again, you're letting time unravel some of those longer polysaccharides, and you're really letting the good stuff get extracted out of the herb, as opposed to grinding it up into a powder and then swallowing it really quick fast.
Wow.
So, yeah.
This is amazing to hear you talk about it, because I really was just sort of on my own when I did this. I was just my own guinea pig, exploring with these herbs. And it's just fascinating. When I heard the podcast and I heard you're using these herbs with your patients, I was just like, wow, like this really it really works. Like this is something that other people do. And so I kind of just intuitively navigated that. But and I was fully expecting it not to work. Like I'm very I'm not fearful of supplements, but I'm not definitely not one to like take any supplement. Like I really am like NSF only, like very like kind of by the book about supplements. So I'm really grateful to have found these herbs, and I'm really excited to know that they're also benefiting other people.
Yeah, no, they're natural things like herbs and probiotics and fish oil, like they can be really therapeutic. I just find, if anything, people are either not quite taking a hefty enough dose sometimes, or maybe not the correct form, or like maybe not giving the herbs an opportunity to really shine. Similarly, like fish oil has wonderful amounts of research on it, but you need to take it with food, preferably a meal with fat. Otherwise, you're not going to absorb the fish oil nearly as efficiently. And you need to take it at a moderately high dose for at least a couple of months before you really notice a difference. But how many people, not to rabbit trail off that, but how many people take fish oil for like a month, like one capsule a day, something they bought at CVS or GNC, and then they're like, fish oil doesn't work, whatever. It's like, no. You didn't dose it high enough, you didn't take it long enough. And like, I know I gave one of my best friends crap the other day. She's a physical therapist, and we had talked about fish oil, and she mentioned that she was taking it like on her way home from work. So I was like, wait, no, you need to take it with food. She's like, really? I'm like, yes. But you just have to give the therapeutics the opportunity to shine sometimes. Sometimes you're taking the right thing, but you just need to tweak how you're taking it.
And always in conjunction with those lifestyle tips we talked about, especially the stress management. We did get a question just submitted about stress and depression potentially impacting acid reflux symptoms. And so we did mention the vagus nerve, which can really heavily impact our mood and anxiety symptoms. But in your experience, can you speak about just the impact of anxiety on acid reflux?
Ooh, it's really tough to unravel because they're so connected. I think anxiety more so than depression, although I could see that playing a role as well in a different regard. One of probably the easiest way to wrap our heads around it is that the brain is in charge of everything. So namely like the wrinkled bits of your brain, right? Like your frontal lobes, your temporal lobes, your parietal lobes. But the higher reasoning centers of your brain are in charge of everything. And then generally your brain is going to relay messages down to your brain stem. And then the brain stem is going to relay messages either down to the spinal cord or the cranial nerves, like the vagus nerve. And then those nerves go on, like the vagus nerve will go and communicate and communicate with and control your heart, your lungs, your liver, your spleen, your stomach, your small intestine, your large intestine, pancreas, kidneys, like you name it. Anything in here, it's controlling. So by that reasoning, similarly with the domino kind of idea, if there's something happening in the cortex of your brain, like anxiety, depression, heck, maybe even traumatic brain injury or concussion or stroke, could affect that downstream communication with the brainstem, the vagus nerve, the spinal cord. And it could really be a domino effect where for some people, maybe they do need to work on stuff here first, whether that means targeting particular pathways, like working with somebody who does functional neurology, for example, or maybe taking nutraceuticals and doing nutritional work specific for their brain, or maybe doing therapy. I'm huge fan of therapy and just like doing the work, so to speak, and trying to understand your stress response, your trauma response, what your body's going through, how your nervous system ticks, why particular habits and patterns emerge when you're under stress. Like there's a whole can of worms to unpack there. But for some people, it's working on the anxiety, the depression, the brain fog, the inflammation can then allow their vagus nerve to function better. And then that allows their gut to function better. So it's a two-way street between the gut and the brain. I just find that right now the dialogue in the internet and social media and even in functional medicine is very much focused on how the gut impacts the brain. but fewer people, with the exception of disease Parazian, are talking about how the brain really affects the gut. So I hope that was helpful. I don't know if I rabbit trailed a little bit too much perhaps, but I do think the two are very much connected, if for no other reason, because the brain ultimately controls the vagus nerve, and then the vagus nerve controls damn near everything, at least gut-wise.
Absolutely. And so that's why on my page, I definitely like to provide some resources. Like there's tons of how to do breathing exercises, meditations, yoga classes. So if anybody's listening and is wanting to get involved in that type of helpful activity, which has been so helpful in my own healing. I know that seeing a therapist and really getting back into my yoga practice was really, really helpful for my own healing. But just getting back to the herbs, another question I get pretty frequently is, do they have any long-term side effects or long-term impacts? Like, are these herbs something that people can take forever?
Oh, that's a good question. With the four that we've thrown around so far. So again, in order that I tend to use them most frequently would be licorice and marshmallow are probably my number one and number two for like reflux and gastritis, I should say.
Yeah.
Those are probably my number one and two. Then I would probably go to slippery elm. Then I might think of aloe vera gel. It's helpful, but maybe not quite to the degree that the others are in my experience with it. All of those, with the possible exception of licorice, I think would be perfectly fine to take forever and ever. The only thing with licorice, why I hesitate, is that licorice, if you're taking the whole herb, not DGL, it can boost blood pressure. It's not the end of the world. Like I said, I have lowish blood pressure, so for me, it's a great thing. For somebody, if you have like 120/80 blood pressure to begin with, you might not want to overutilize that particular herb, or maybe just like use DGL instead. It has some immunomodulating qualities to it. The others might too, but licorice in particular can help balance out the immune system, which can be relevant, especially for cases of autoimmunity and inflammation. Usually the way that licorice modulates the immune system is typically in a way that's very beneficial for people with autoimmune disease. But theoretically, depending on the state of your immune system, maybe there would be some people who might not want to take licorice forever and ever in a high dose. I will say too, one thing I like about herbal medicine, the more I get into it, is that there's oftentimes a long history of using herbs that we can look back to for some information. And historically, traditionally, licorice is a very low dose herb compared to some other herbs. Whereas again, like slippery elm, you could take that 5-10 grams and really have at it. Versus licorice, usually it's like a very minor part of a bigger formula. So like in Chinese medicine formulating, or like when I'm blending teas or tinctures that are custom compounded for my patients, usually the way I will do it is I'll have like 90 or 95% of the bulk of that herbal remedy be other herbs. And then I'll just add a couple of ml of, that was me doing a drop of bottle if you're wondering. But I'll just do like out of, a 60 milliliter bottle, I might do 2 milliliters of licorice. Because it's there to enhance the action of the other herbs. And it's there for that little extra anti-inflammatory immune modulating goodness. It might not be the star of the show in all of my herbal compounds, but like that's usually how it's used traditionally. So licorice, I would think that you wouldn't want to take it at a high dose for a prolonged period of time, because that's just not the way the herb is traditionally used. I don't know if it's overtly not safe. I think that's just, I would kind of take a note from the thousands of years of human beings using licorice root and how they've done that so far. And it seems to be more of a, yeah, you can use it long term, but it's going to be a lower dose herb kind of a thing for most people.
And so have you seen in the progression of healing, if your patients that they no longer need the herb, they take it as like maybe a precaution or when they have a flare, or how does that progression normally go?
Yeah, my goal is to get people off of the majority of their supplements. With the exception, I think it's reasonable for every human being to take like a multivitamin, vitamin D, maybe a fish oil, maybe a probiotic, right? Like I could get behind most people taking like 3 or 4 products indefinitely, just to kind of cover some bases and make sure that they're kind of preventing anything too squirrely from happening. but yeah, I don't have a lot of patients where I found that they need to take that sort of stuff long term. Sometimes it'll depend on how long you've had the symptoms and how bad the symptoms have been. So I know, like, one of my patients, for example, she has had pretty wicked gastritis on and off for several years. And the thing about it is that she also has SIBO. And when her gastritis flares, it impedes her ability to take her prokinetics and eat the FODMAPs and like do the things that normally we would be doing to keep the SIBO well managed. So for us, it's like we need to make sure the gastritis is always in check and not there. Because if the gastritis rears its ugly head, A, it's usually pretty bad for her, but B, it's going to really set all of the SIBO stuff back in motion. And it ends up being that she's not dealing with a flare up of a single condition. It ends up being that she has two different flare ups and they both stuck. So then we're really scrambling to try to figure out what happens. So like with a patient like that, where we know it's a much bigger deal, then for her, we had a similar conversation when I started working with her and we figured out some of the nature of her SIBO. Like we had a heart to heart and I was like, all right, look, this prokinetic is going to be your new best friend forever. You might as well take out stock in the company that makes it because you're going to be on this forever. I would recommend at least. And we knew the reasons why, like we had a conversation about that and we ended up saying, yeah, we could get behind that. That's cool. Not all of my SIBO patients I feel that strongly about, but for her and her history and her symptoms and what we worked on together, like that's going to be part of her regimen. So similarly, I could get behind having somebody like that on like a low dose of licorice or a low dose of marshmallow or slippery elm or aloe or something to just kind of keep the stomach lining happy and healthy and not inflamed indefinitely. But I don't think that most people need to do that.
And so from my understanding, correct me if I'm wrong, but the herbs work to kind of coat the lining of your GI tract and like build up that layer so that the acid doesn't cause as much irritation. Is there any other mechanisms that goes on there as far as protection?
That's one of the big ones, especially the herbs that have a slimier quality to them. That's usually how they're understood. I think also, so like medication wise, it would be a little bit more analogous to something like sulforaphate, as opposed to something that's going to mess with your, the PPIs or the H2 blockers and suppress stomach acid.
Yeah.
But yeah, they usually are thought of as soothing and coating the stomach and the intestines to a lesser degree. They also, most of them will have some anti-inflammatory or immune modulating effect to them. The most profound out of the four that we've talked about, I would say, is licorice, with a possible runner-up of aloe being the next as far as like immune modulating work that it can do. I'm sure the other two do as well, and we just haven't studied it yet. But yeah, there's some element of anti-inflammatory or immune balancing that happens. And then also some of them, I can see any of them, maybe less so with licorice. I'm not sure about licorice and the research, but all of them have the potential to be selective prebiotics for the good microbes as well. So like I know I've seen research for slippery elm, for example, that slippery elm will help feed good bacteria like bifidobacteria, and then indirectly it will inhibit some bad bacteria because now you're out competing them and they don't have as much turf to take up space in the GI tract. So I know that some of the herbs, particularly, I know slippery elm I've seen research on. It wouldn't surprise me if the other ones do that. Any of the herbs with a slippery, slimy kind of quality to them should have that same ability. And then the licorice, it could be that the glycyrrhiza in it, the stuff that makes it sweet, or another compound or another anti-inflammatory in the licorice might be a selective prebiotic for the good bacteria too. But I'm not as familiar with that body of research, if there is any.
Very interesting. So I have two more questions because I want to be mindful of your time here. But have you ever, so I personally, I will have a flare maybe like once a week just because I'm not very careful about what I eat as far as triggers. And I am a huge fan of the throat coat tea by Traditional Medicinal. Any thoughts on that? Is that something that you recommend, or do you feel like the dose is not as high in that?
Yeah, no, I think throat coat is nice. I do remember it's got, I forget all of the ingredients now. I know it definitely has licorice in it because I've tried it before, and my first taste that I perceive as, whoa, licorice.
Yes.
Okay, hold on. It's funny because I'm looking at you and you're right next to my little tea collection here. I don't
Oh,
have that at the moment. I have gas and bloating from Gaia. I've got digestive nirvana, fun name, and I've got these ginger digestion elixir crystals handy, but I don't have throat coat right now, funny enough, but I know I have some at home.
it has slippery elm, licorice root, ginger, cinnamon.
Okay. Yeah, my only hesitancy is that some people might not do super well with ginger if they're really flared up. I like it if you can tolerate it. I love ginger. It's one of my favorite herbs. And one of the talents that ginger has, in addition to being anti-inflammatory, is that it has some prokinetic qualities to it. So if you do struggle with any sort of dysmotility, SIBO, delayed gastric emptying, that sort of stuff, like basically any IBS or SIBO presentation usually has some motility component to it. And if that is the case, usually ginger is wonderful for those people. But if you're really flared up with gastritis in particular, like the patient where I was saying that when she gets a flare up of her gastritis, the SIBO gets pissy too. One of the bad things with it right now, because she's flared up right now, is that she can't take her prokinetic because the ginger in the prokinetic makes her gastritis worse. So then her SIBO gets worse. So we've been trying to wrap our heads around what else can we do to act as a prokinetic and regulate motility until we get the damn gastritis to calm down and get you to a point where you can use your prokinetic again. So yeah, so ginger might be a little bit spicy for some people if they're really, really flared up, but otherwise those are great ingredients.
That makes sense. That makes sense.
Yeah.
And do you have any last wisdom, like brands of these herbs or other like tips, anything you want to share with people struggling with acid reflux, looking to manage it holistically and potentially with these herbs?
Yeah, I think couple fold. So brands, for any of the ones that I talked about where I recommended the bulk herbs, so like the powdered whole licorice root, the powdered slippery elm, the chopped and sifted marshmallow root. I get a lot of my herbs from mountainroseherbs.com. They're great. The shipping is a little on the slower side though, so it probably is going to be a little bit less thrilling for somebody who's just ordering like two things. For me, I order pounds and pounds of herbs at one time, so I don't really mind waiting. Because then that's just awkward. Anyway, so Mountain Rose Herbs is wonderful, but they're a little slow in the shipping. Instead, usually I'll recommend when I have patients just buying it for themselves, you can look into Starwest Botanicals or Frontier Co-op. Those are both two really good companies that I get herbs from as well. And sometimes, depending on the herb, sometimes you can find them selling those on Amazon. I know both of those companies have a limited stock of what they sell on Amazon. And I know that one of them definitely has marshmallow. One of them definitely has licorice. I forget where I've gotten my slippery elm before. But usually one of those two companies will have something on Amazon and then you can get it with 2-day shipping. And it's pretty reasonably priced that way. With DGL, if I'm getting the deglycerized licorice for somebody who might have hypertension or borderline hypertension, I personally use one from Vital Nutrients. I'm not super wed to that particular one. It's just the one that I've landed on for some reason. But there's probably other brands of DGL. They have chewable DGL also, and they have like chocolate flavor and all sorts of stuff. Just be cautious because sometimes there's other fillers and stuff in those. And if you have reflux and you also have IBS and you're FODMAP intolerant right now, if you eat one of those little, chewables with the DGL, sometimes they'll have like mannitol or a little bit of a FODMAP-y quality to them. So just be mindful of that because sometimes they'll put a little bit of added sweetener in with that, and it's usually a polyol type. So just be mindful of that. But yeah, and then there's one other product that I'll throw out there as far as like something else that could be useful. This was actually part of the protocol for my mom when she was struggling with recovering from her big geyser of a bleeding ulcer. But for her, one of the products I had her taking for quite a while was a Biotics research product called Gastrazyme. I forget for the life of me what the ingredients are off the top of my head, but that has been really helpful for some of my patients who have gastritis or acid reflux. In an ideal world, you could either swallow them, they're little tablets, they're like green tablets. you could swallow them. But if you have really wicked acid reflux, or if you have any suspicion that the acid is literally refluxing into your esophagus and coming back up, and you're thinking that that esophagus sphincter tone is kind of iffy, you could actually chew these up and then swallow them, and that'll give it more of an opportunity to soothe and coat the esophagus, as opposed to just getting in your stomach and bypassing the esophagus. They don't taste great, so just keep that in mind. I'm not claiming that this is going to be a tasty therapeutic opportunity for you. You can chew those Gastrazyme tablets, and that can be really helpful if the esophagus is more directly involved. But Gastrazyme has been very helpful for some of my patients as well. Yeah.
Awesome. I'll probably text you for the names or the links of those, just because I know people are going to be wondering about that. But this was so helpful. I'm really so grateful that you came to talk to us today and share your wisdom of this world about managing acid reflux, because it really, really can be so useful. So thank you so much for coming today. Thank you for all the work that you do.
Absolutely. Yeah. Thanks for having me on. And I look forward, we'll have to think of another thing that we could talk about, because it's always fun to hang out with fellow gut health nerds and talk shop. So
absolutely. I'd love to do one on the vagus nerve potentially. I think that would be awesome.
That's always a juicy topic.
Always juicy. Where can people find more of you?
I'm primarily a YouTuber. We were joking about this before we logged on, that I feel like the old lady of Instagram, because we were going to do this on Instagram. I was like, how do I do the Instagram thing? I am on Instagram, not nearly as much, but I'm at Triangle Guts plural with an S. And I always wonder if people wonder. So the area of North Carolina I'm in is the Triangle of North Carolina. So that's why all of my channels are Triangle something or other. So yeah, Triangle Guts is my Instagram handle. My YouTube channel, where it's just me doing videos about various nerdy topics, is Triangle Holistic Gut Health. And then the podcast is on YouTube, and it's on like audio only podcast, and that's called the IBS Freedom Podcast.
Amazing, which is great. The podcast is phenomenal. If anyone is wanting to learn more about IBS or SIBO, it's really great. So I'll link all of that as well in the description below. But thank you again, Nicole. This was awesome.
Yeah, thanks for having me. It was a lot of fun. I'll look forward to doing it again.
Yes, definitely. Thanks again. Talk to you soon.